At Children's Hospital, we understand that preparing for your child's upcoming surgery can be stressful. While everyone's experience will look a little different, this video is designed to help prepare you and your child for what to expect. Our Children's Hospital teams are experts at caring for kids. Throughout your time with us, you'll meet several of our team members, from child life specialists to pediatric nurses, anesthesiologists, and surgeons, all working together to coordinate your child's care and make the process as seamless as possible. A few days before your child's surgery, a member of our care team will call to confirm your arrival time and get additional health information about your child. You'll also be given instructions on how to prepare your child for surgery. It's important to follow the directions you're given from our care team, especially those related to medications and when to stop eating and drinking. Not following them may result in your child's surgery being canceled or postponed for safety reasons. Some general tips for the day before surgery include ensuring your child drinks plenty of water, picks out comfortable clothes to wear on surgery day, and understands what to expect. We know discussing surgery can be stressful for both caregivers and children, but it's important to give kids a chance to mentally prepare and ask questions. We have resources available at muhealth.org/childsurgeryprep to help talk to your child, including a surgery preparation coloring book. Here are some other quick tips from our Child Life team. Be reassuring but honest with your child about what will happen. Use short, simple terms to explain things. Let your child know that having to go to the hospital does not mean that they've done anything wrong. Reassure them that if something hurts, there are ways to help the pain, and emphasize that the hospital stay is temporary, and focus on what your child will be able to do when they go home. Your child's surgery will take place at University Hospital on MU Healthcare's main hospital campus. You can park in the patient and visitor garage that is connected to University Hospital, or in parking structure 7, which is directly across from the patient and visitor garage on Hospital Drive. Patients who park in the patient and visitor garage can access our dedicated children's entrance by taking elevators to the second floor. Patients who park in parking structure 7 between the hours of 6 a.m. and 6 p.m. can use our shuttle service. To access, simply wait by your vehicle, and a shuttle will come to pick you up and drop you off at the main entrance of University Hospital. After your appointment, return to the main entrance, and a shuttle will bring you back to your vehicle. Once you're inside University Hospital, make your way to the second floor and follow signs to our children's registration area. Here, your child will get an ID bracelet to wear for the remainder of their stay. This scannable bracelet will allow our team to access your child's medical record and keep track of their care throughout their stay. The bracelet gives our team information about your child. After check-in, we'll direct you to take the green elevators to the third floor. In the waiting area of the third floor, there will be a phone. You'll use the phone to call our team and let them know you have arrived. A member of our team will come get you when it's time to prepare your child for surgery. Next, you'll go to a pre-op room. Up to 2 parents or guardians are allowed to accompany children. We'll start by taking your child's weight, temperature, blood pressure, and other vital signs. This is all to ensure that our surgery plan is tailored to your child. Here, you may receive cleansing wipes to use before surgery, and we'll ask your child to change into a hospital gown or pajamas. You'll meet with multiple healthcare teams in pre-op. Each team may ask a lot of questions. You'll often be asked the same questions from different team members. This repetition is done on purpose to verify that everyone who is involved has the same information about your child and what is being done. Keeping your child safe is our top priority. A child life specialist will come talk to your child to provide developmentally appropriate and kid-friendly preparation for their surgery. They are here to help familiarize and normalize the hospital setting and support patients throughout their visit. Anesthesia will come talk about options for sedation during surgery. The anesthesia team also starts IVs to give fluids, antibiotics, and pain medication to your child during surgery and in recovery. Young children can, if needed, be given a sedative medication to help reduce stress during the transition to the operating room. Once in the operating room, patients will breathe into an anesthesia mask. The mask is filled with anesthetic gas, which will ease your child to sleep, and once asleep, an IV will be placed. For safety reasons, older children and teenagers will have their IVs placed in pre-op before going back to the operating room. Techniques such as distraction and topical numbing medicine can help to ease fears and pain during this time. Older children will receive sedation medication through their IVs. Our surgical team will also visit with your family to answer any final questions about the procedure. The nurse who will be with your child throughout the surgery will also introduce themselves and do one final safety check before heading to surgery. Once we've completed all of the necessary pre-op steps, our team will take your child back to the operating room. At this time, parents or guardians will be taken to a waiting room. There's a phone in the waiting room for parents to call the surgical support team to get status updates on their child's surgery. After surgery, a member of our healthcare team will come get you when your child is in the post-anesthesia care unit, or PACU. One parent or guardian is allowed in the PACU. Your child may still require oxygen and may experience pain, upset stomach, sore throat, itchy nose, shivering, or blurred vision. These are normal reactions and will help manage these symptoms. Everyone recovers differently, so time spent in the PACU can vary. For privacy reasons, we ask that no photos, video, or phone calls take place in the recovery room. Children going home after surgery will be discharged when they have completed the recovery process, pain and nausea are under control, and you've received their post-surgery instructions. If your child requires a hospital stay after their surgery, they'll be transferred to our pediatric inpatient unit at University Hospital. Once the initial phase of their recovery is completed in the PACU, the recovery staff will take you and your child to their room. On behalf of all of our staff, we want to wish your child a safe and speedy recovery, and we thank you for choosing MU Healthcare.